076 Today we are at the Friends of RSPCA Gladstone, and I'm going to do a demonstration on assist in healthcare of animals. Here we have Leo, a blue Great Dane. As you can see, his colour. Blue is like a bluey grey. By his chart here, you can see that he's been hydrobathed. His weight weighs in 53 kilos. He is microchipped, and he's been wormed for worm and heartworm. I'll just do a physical examination. Just check the behaviour. He's quite friendly. He's not barking. He's wagging his tail. I'll go in. Because he's so large. Ooh, it's very tricky. I'll just put a lead on him to be able to control him. His coat is quite smooth. Physical examination, as you can see, he's a little bit underweight, quite underweight. I can see his hip bones on the top. I can see and feel his spine protruding. And just on this side here, he's got a callus that's possibly from sitting on concrete for long periods. He's loving this.
No.
You can identify a Great Dane breed by their extra large size. See, he's quite large, but he's probably only not even 1 or 2 years old. They have a mesocephalic shaped head, which means their head is as wide as they are long. So he doesn't have a very narrow, but also floppy lips here. Super slight feet. He's leaning into me. So by his behaviour, quite calm. Just check his eyes. Because he's such a good dog, I don't really need to hold him down. His eyes are clear. He's not drooling, so he's not stressed at the moment, but he's leaning into me like he wants a lot of affection. This dog is fully intact. Be on his side, so it's not a very intimidating approach. Oh, look. Clean teeth, pink tongue. Anyways, I would put him in sort of like a headlock like this to restrain his head. Would open their mouth and pop the tablet down their throat and close their mouth and then rub their neck like so, and they usually tend to swallow it. By his size, I could put it in a bit of food and he would just gobble it right up.
Go.
If the dogs were to have any medications or health issues, there would be another chart with their medication attached for the kennel hands to treat the animals with. Unfortunately today for the video we don't have any dogs with medication, but I do have a video demonstration of me giving medication to a previous dog. Hi Ben. So today we are the Friends of RSPCA Gladstone, and I'm going to check the vital signs on this dog called Artie. He is a male albino German Shepherd, and so vital signs, we're going to check his weight, his hydration status, heart rate and respiratory. So we're going to weigh him again. Come up here. Up here. His weight's important. When administering medication, dosage is dependent on his weight, and also you can tell whether a dog is underweight or overweight. Sit down, boy. Sit. Sit. Average weight for a large dog is between 24 and 50 kilos. So he's 24.7 kilos. So he's at a reasonable weight. Checking his spine. He's got it. You can feel his hips and protruding spine, but Shepherds being active dog, they shed, they don't maintain fat. So he's at a healthy weight. Could do with a bit, like 2 more kilos, just to fill in those spots. Also, come here, mate. Sit. Check his hydration. So on a dog's gums, check the colour of their gums. Pale is for shock, hemorrhaging or anemia. Yellow gums means jaundice, and blue gums is dysphonia, so it means struggle to breathe, means there's not enough oxygen in the blood. Also, if you check their gums and they're nice and wet, it means they're hydrated. If they're dry or sticky, it means that they're dehydrated. Breathing, breaths are at 100 breaths per minute. Smaller dogs have more breaths per minute than larger dogs. To check a dog's temperature, you would place a thermometer in their rectum, which we don't have a thermometer at the centre at the moment, but a normal dog's temperature is 38 degrees Celsius. You can check a dog's heart rate in their femur, which is behind their hind legs. There's an artery there. Careful, buddy. So you would get their pulse in their femur, and 15 beats per 15 seconds. So that works out to be 60 beats per minute, which is the average heart rate for a dog. When a dog is vetted, so when we have a dog that's going to be at the RSPCA, they go to the vet checks for vital signs, and they are recorded on their health history. We also just have, if a dog is sick or taking medication, that is documented on the chart in front of their cage. Signs of illness in a dog is they will be lethargic, you're vomiting, diarrhea. If the dog is not acting its normal behaviour, so if you have a very boisterous dog and all of a sudden it's quiet and sitting around, it's a sign that the dog might be ill. So common illness and disease in dogs. Dogs can get worms and fleas, and they are treated with so we've got flea treatments. You can get flea collars, flea wash, flea spray, Kristal as a tablet, and then worming treatments such as Propantal. You can identify worms in dogs. Puppies will have extra bloating, and also there's worms in feces. If you worm them every 3 months, that helps prevent worm infestation. Also with fleas, you can see fleas, and sometimes like the flea feces residue is just like little black crusts in their fur. Ticks need to be removed with a tick brush, but also Advantix is a great flea treatment in dogs. If a dog is diarrhea or there's blood in their stool, that's a sign of they could have a virus, they could have parvovirus. If they're vomiting, always seek vet treatment when your dog has vomiting or diarrhea.